At this point, we're going to hear from KZN and our presenter there, Futhi Mazibuko. And she's ready to take us through the insights they got from their province. Over to you, ma'am.
Thank you for the opportunity that has been granted to us to share the opportunities and the experiences that we have learned while trying to manage the COVID-19 pandemic in the province of Kwazulu-Natal. I will be presenting a case study on the rapid evaluation.
So, ladies and gentlemen, in preparation for our next presentation is to review the key highlights that have come out of the previous presentation. It's very clear that collaboration is key in delivering this complex project. However, since the environment is ever changing, we need to remain adaptable. That's why the concept of adaptable governance is quite key. It's expected that organizations, when they are faced with changes within the context that they operate, they need to adapt, otherwise they experience a lot of challenges. Even at the policy level, we expect that level of adaptability. Hence, the various presenters have been highlighting the need to work, let's say, with the private sector, to work with the SMMEs, to be able to execute this project. And we heard from the Department of Monitoring and Evaluation as to how they are also supporting the provinces by making resources that are available across the different provinces so that they can execute based on their plans. Another issue I would like to highlight is how the provinces were forced to some extent to pull resources from other activities to channel them to these emergencies. Of course, there are trade-offs. When they pull those resources, it means some of those plans that were previously planned to be executed, they need to be delayed. Some of them need to be cancelled. Of course, you can appreciate that such a change in planning requires interaction with various stakeholders. It requires interaction with various stakeholders. So you can appreciate that earlier when you formulated the plan, you had to talk to the stakeholders. Now you have to change the plan. You have to go back to them and change that. It can't be a very easy process, no doubt about that. It requires a certain level of leadership to convince the various stakeholders that the projects that were earmarked to deliver services to them, some of them would be delayed. On that note, let's hear how KZN dealt with some of these challenges as they were executing their own plan. Over to you, Futhi.
Thank you, Program Director. Good afternoon, ladies and gentlemen. I'm from KZN, and we would like to thank you for the opportunity that you have granted to us to share the experiences the learnings from the implementation of the COVID-19 in response to COVID-19 pandemic. I will be presenting a case study on the rapid evaluation for the KZN COVID-19 implementation plan. So here, my presentation is basically to share the insights on different perspectives in terms of how well the plan was executed by and implemented by the province of Kwazulu-Natal. In the contents here, I have the background and context, the methodology, findings, what worked well, what do we need to do differently, and recommendations. Here I will be sharing a high level of information. The province of KwaZulu-Natal embarked on the implementation plan to respond to the COVID-19 implementation. We used the structures, the existing structures that was led by the Premier himself and the Director General. This was in the cluster of the governance, state capacity, and institutional development. So this plan was developed with all the clusters of the province. However, it was led by the Premier, so that there would be interventions, that the interventions would be outlined and how well they can be implemented by the implementers in all other clusters. So what happened here, the 4 clusters had to share and discuss the interventions. Some of the interventions were cross-cutting, and some of the interventions were just purely to the implementing department. The flow of information was to be collected at the implementation level and reported to the clusters at a specified time. Some were daily, some were monthly, and some were and eventually we'll get the quarterly report. Then the coordination was agreed that at a departmental level, the accounting officer will endorse the report, and then it will be submitted by the M&E coordinator to the technical cluster, and then move to the clusters, all the clusters, and then coordinated and integrated at a governance cluster. Colleagues, here, what I have is the evaluation perspective in terms of the implementation plan. And it does highlight the opportunities. It also highlights the challenges that were experienced by the province of Kwazulu-Natal in trying to implement the COVID-19 recovery plan. And it also identifies the lessons that were learned while trying to implement all these strategies as well as the interventions. In the background and context, we had to formulate the questions in terms of how we were to evaluate the implementation plan. These questions, they included the interventions themselves in terms of if what was outlined in the plan was really addressed in the actual facts, and it was evident that it was indeed addressed, and as well as the specific objectives of the COVID-19 implementation plan, if those objectives were achieved. And the other question that we had was that if were the intended objectives that were outlined in the plan and for the priority projects being evaluated, if they were achieved, because they could be outlined, but then they could not be achieved due to some reasons, because COVID-19 was new to all of us. And also we had to look at the deviations, if there were any deviations, and how did they affect the implementation, and what was done to improve or to make the changes based on those deviations and challenges that were met. And the methodology, there were multiple approaches that were used in formulating the methodology for evaluation of this nature. We began as a team in the M&E. We're being assisted by the provincial planning commissioners, the 2 professors from UKZN, and we developed an indicator framework, which was to outline all the interventions, the outputs, the targets, and everything that had to be tracked in the implementation plan. Then the data was sourced from the implementing teams. As I've mentioned earlier, that the departments to decide who will coordinate and who will report to the Premier. And this is what we exactly followed because of the structure that was already in place for the implementation plan of the COVID in response to COVID-19. So we were receiving the data that was in the indicator framework from the implementing team in various departments and sectors. Then based on that information that was provided, then we had to draft a preliminary analysis and then have a preliminary report in place, which is what we have today that I am presenting. And after that preliminary report, and with all its outcome from the analysis and the lessons and experiences, then we had to do the focus group engagements, which just happened in last 2 weeks or last week. And the focus group engagement involved the implementers as well as the coordinators and the monitoring and evaluation officials who were making sure that all the reports are being integrated and consolidated. And after that, it was going concurrently with the verification exercise, because in terms of the methodology, we are getting the reports from the departments. However, we still need to verify if that report is evident. So here we had to request for the administrative records or even the evidence in terms of if they say, for example, 300 static tanks were delivered in different schools. We want to get a report that was presented, for example, in a meeting with the HOD, and those minutes were signed. So any evidence that could say this exactly was executed as it is reported in our indicator framework. The other ongoing activities as of today, we are still engaging with the principal informants in terms of the findings from the preliminary analysis, as well as the next one will be the conclusion of the verification exercise, which hopefully by the end of this week, and the documentation of those findings, as well as the integrating the report from the findings of the focus groups and the findings from the verification exercise. And that will then take us to the compilation of the final draft report for the province. To highlight again on the methodology, in total, in our indicator framework, we discovered that there are 22 interventions with 30 outcomes or deliverables and 71 outputs. And this it showed that it was mammoth now to chase all these 22 interventions with 71 outputs. And at some stage, you will see that indeed what gets monitored, it gets done. Because when we started in the first quarter last year, towards the end of first quarter, there was some resistance here and there in terms of getting the reports, and there were delays. But the moment the key informants understood that we are monitoring here, we have to get this report, and it started to flow, and people are starting to be accountable. Here, these 22 interventions are across the 5, from what we received from the implementation plan, COVID-19 implementation plan. We could see that we can divide the main clusters into 5, with one focusing on social and health to flatten the curve, and the other one, the social and justice aspect, to reduce the social impact, and the other one being the justice and security, as well as the economic recovery, and then the governance, which we in the Office of the Premier had to ensure that every area of the interventions are in an integrated and coordinated manner. So all these interventions were in our indicator framework. We also sensitized the fact that some of the interventions were cross-cutting. I will make an example on the GBV, where you find that some of the information you will get from the Department of Social Department, and some of the information you will get from the Social and Justice Cluster. So there was a caution on that, because the report has to talk to each other in terms of its integration. And in our indicator framework, we had to track the following information, which was the targets and baseline information where it was applicable. For example, some of the interventions were the interventions that were already in place in the province. And therefore, when the COVID-19 hit, there were already baselines and targets. There could be some changes here and there, but we could have the information on baselines. And also, we had to track the activities. What is it that they put in place as input to achieve those targets in terms of the resources, and what was done to achieve those targets or the interventions. And if the data that was required, we would also request for the source of information, for example, the contact persons, the custodian of the data, because this, in a long run, assisted us in terms of identifying the people that may form part of our focus groups engagements. And we also had to check if there were budgets that were received or that were allocated to each and every target or to each and every indicator. We also had to check the level of quality of information, if it's verifiable, if it's reliable, so that when the time comes in terms of the verification, we know what is at hand in terms of the issues that our coordinators that were reporting to us had experienced. So we gave them an opportunity to explain that as well as the deviations and any other reasons that could have been a challenge in terms of achieving the targets or the interventions. This is just an example in terms of the findings now that we extracted from the report. Our report has many tables, so we just were interested to show here how our findings, how we projected our findings in the main report. This is just an example on the conduct cases traced and the monitored conduct. But in actual fact, what we want to show here is that those in cases where the indicators were and targets were achieved, we would make them green, and we will not color where there was in a case where there were no targets mentioned, but where when they were not specified, but something was done, or where they do not link to the indicator. And the last one in blue is where there were no targets at all, and we had to make it blue because there was something that was done, but there was no mention of the targets. The key overall findings to this evaluation, one is that because we were evaluating the plan, which was the implementation plan of the COVID-19 implementation, is that the interventions as planned were executed as conceptualized. So this was a tick in terms of the province from what they had to plan in a short space of time to actually see that it's being achieved. And the second one is the extent and level of leadership that was provided. Premier himself was leading all the engagements, and he was briefing the media every now and again. He still does that, but I will remind Chair that in KZN, we found ourselves in the midst of the second wave, and it hit the province in a big way, but the working together of the leadership of the province made it more bearable even to the rest of the implementers and the rest of the people that form part of the broader plan. And the analysis of the interventions indicate that the province responded comprehensively to the COVID-19, regardless of the disruptions and in trying to address the direct impacts, but the province response was comprehensive. And the results also are in line with the interaction report that was done by the Department of Health and and WHO, as well as UKZN. It does concur the reports that we get out of the study is in line with what they found in their reports as well. The regular meetings and engagements as well at that high level, it also allowed the province to achieve what it did in terms of needs and the changing environment that was happening, in the third term, particularly when the second wave hit. But other findings that are also negative is the lack of baseline information, which was concerning to us as the evaluators, because it was not, some of the interventions or the indicators were not done for the first time because they were responding to COVID-19, but there were interventions that were already there. For example, the boreholes and the tanks that were supposed to be provided to schools. However, there was no information that came through in terms of what were the baselines, and it's a cause of concern in terms of monitoring of certain interventions in the province. The trends in relation to gender-based violence as well, there were no baseline, which is something that is very critical now that we know that in our country, this is the main issue that we are faced with after the COVID-19. Continuing the overall findings, the quality and depth of information was inconsistent at times. When you look at some of the interventions and versus the clusters, that some of the targets, they were not linked to the indicators, and some indicators did not respond to the intervention. So this was also a cause for concern. Some could be caused by the fact that they were cross-cutting. However, that was being monitored closely as well in terms of how we receive the information from the key informants. Some of the targets, they do not align with the indicators. I think I have stated that. And the outputs in relation to targets shows that 50.7% were not specified or linked to the indicator. Because we tracked this indicator framework from Q1 up to Q4, because when we track the information from Q1, we could see that we were not getting much of information to come up with the report. Then we extended to Q2, because this was meant to be a very rapid response. However, the information that we had did not allow us to respond immediately as initially planned. And therefore, in Q2 and Q3, that's when we saw that the second wave has hit and we have to continue track this report. And we eventually decided that we will just make an annual report and extend it to the fourth quarter. So here, where targets were indicated and were met, only 14%, 35% of those were met, and 14% were not met. What comes to mind here is that by the end of quarter 3 or quarter 4, we would have known what targets do we have in some indicators, but the indicators like health, where you do not know how many people will be infected, how many people will be the contacts, and they need to be traced. That definitely there we were aware that we will not get any of the targets. What worked well as per the findings of the study is that the biggest gains was learning in respect of the systems, reporting, integrating, the budget, reprioritization. There was quite a number of things that were done within the province, that the sharing that we've never thought it would happen the way it did when everyone comes together the way that it happened. And the level of preparedness, because level 1, the first wave of COVID-19 was sort of, it gave us a chance to prepare and to be aware of what is to come in the second wave, even though it was overwhelming during the second wave. However, there was a level of preparedness in terms of all the implementation across all the sectors. Again, there was a learnings in relation to monitoring the interventions, and in the middle of chaos like this, because it was the first time as well in the aspect of monitoring, that we will monitor something like this. We learned along the way that the more we are formal, the more we request for this information, the better, and the more we get the response. And there was quite a number of experiences that we learned as at the monitoring and evaluation side. Organizing departments into clusters in terms of governance. This one, the way it was, the structure into which how the information flows, it was also something that is commendable. Because it was going further to the district levels, those district command councils, and that they will feed back to the departments, back to the office of the premier. So everything was coordinated and integrated. The knowledge sharing between the private and public health facilities, there was quite a lot of sharing, as it came out in the focus groups as well, that they benefited a lot from each other. The other thing that worked well was the digital platforms to ensure that there is business continuity in the midst of crisis. Because the moment there was the first hard lockdown, that was a wake-up call, and on the other side, it does prove that when you are under pressure, that's when you become more innovative, because there were so many ways of doing things digitally, and it was more, although it was demanding in terms of getting all the necessary tools of trade for all the employees, but it does show that it did work well at the end of the day. Monitoring and evaluation through, I've stated this, that we worked with the provincial planning commissioners and they are the professors from the UKZN. Two of them were working with us, monitoring and evaluation to conduct this study, and we took advantage of them because they are part of our provincial planning commission. It did not have to go and we source and outsource, say, the consultant or other people to assist us even in the analysis of information. We also have been supported a lot by the DPME colleagues throughout all the stages of this evaluation. What should be done differently? I have mentioned quite a number of times that some of the targets were not talking to the interventions, or they were not stated. This again, it says we should do something in a different manner. The targets in relation to the ongoing activities, they need to be reviewed and revised if it's necessary, as well as the shift. Now that we are moving to the vaccine rollout, we need to have the indicators developed and monitored closely, and everything must be stated clearly just before the implementation of that vaccine rollout. We also had a serious challenge in terms of getting data. Hence, we moved from quarter 1 to quarter 2 to quarter 3. This was being the fact that there is no centralized portal for the province where one could source the information and access the information at real time. So we really feel that it needs to be done differently. This time around, we need to have those live systems that will assist even in terms of monitoring the implementation. And the other one is that we feel that if we have to do another evaluation, even if it's for the vaccine rollout, we need to brief the implementers well in advance, just before the implementation or at the planning stage, that this is what would be monitored and what they should expect from the monitoring and evaluation. The recommendations, we recommend that the operationalizing and centralizing the establishment of COVID-19 performance management system and collecting information daily, weekly and monthly, as specified in COVID-19 plans on outputs, are critically important to ensure improved monitoring of interventions and address the data challenges identified in this evaluation. I have mentioned the issue of the systems. So we still believe here we are emphasizing that it has to happen. We need to have a system of management where we will be able to monitor. And systems approach will also assist to improve data quality and reliability, as well as provide timely information. As I have mentioned earlier, that at some stage you will track the quarterly report and get it towards the end or in the middle of the fourth quarter. That's when you feel that I have received all the information I've been looking for. Monitoring and evaluation capacity. We feel that the M&E capacity in the province needs to be strengthened, as well as be and developed to ensure more independent verification of information. Because at times you can see that there is a lack of capacity in terms of verification of information, and therefore we strongly strongly request that this one is being looked at. And for the monitoring and evaluation purposes, it is important that measurable targets are developed that link to well-formulated indicators. This one is a recommendation because in the beginning, when the implementation plan was developed, the implementation plan to respond to COVID-19 was developed, MNE was never had time, or there was no working closely with the team that was doing the formulating the COVID-19 implementation plan, so that MNE will guide in terms of the targets as well as the indicators, and therefore we also request that this one is being looked at. It's very critical that whatever that is being implemented is monitored and is measured, so that we know if we are failing, that we need to improve here, so that we also know that when we are being successful, we need to learn from this success, because not knowing between the two, we will probably continue with the intervention. However, we are rewarding the failures. The other recommendation is the impacts of COVID-19, the comparisons where possible. I can even say this platform, the platform like this, has made me realize that, okay, this is what has happened in another province, and this is what has happened in, when I was listening to other speakers from the rest of the provinces, I could see that I can compare one or two of the areas where KZN needs to improve, where KZN, where we can learn the standard of best practice. For future projects of this nature, we also request that the technical team overseeing the overall project, implementation of this project, to engage with the monitoring and evaluation. I think I have stated this in my previous slide, that we never had a time where we engaged each other and guide each other in terms of the information that will be monitored, as well as the indicators. And again, the continuous monitoring, which was done for the reporting purposes, is needed. That is structured and aligned for evaluation purposes. So this one is still the emphasis on the previous slide that I have mentioned. Thank you so much, Program Director.
Great. Thank you very much, Futhi, for those insights. In fact, your very last comments, they are important by highlighting the benefits of hosting a workshop of this nature, that as your colleagues were presenting before you, you're already making some comparisons and extracting value out of those presentations. That is quite good. I have some few questions for you.
Yes.
Out of the 32 hospitals, what were the levels of care, i.e. at regional, district or tertiary hospitals?
Can you repeat the question? Out of?
Yes, the question is, out of the 32 hospitals, what were the levels of care, i.e. at the regional level, at the district or tertiary hospitals?
Apologies with that, Program. I will not be able to respond to that question, because it zooms into the report that was shared with us by the Department of Health.
Okay. All right. No problem. Thank you. So why do you think that KZN was badly hit during phase 2?
The second wave was really in KZN, even when you look at the numbers of the people that were infected and the cases that were there in KZN. So the province was really hit hard, and there was a case where in one of the senior managers in the justice cluster, all of the senior managers were infected. In actual fact, they had to be isolated and be not at work. Some of them were sick, and there was a case of destitution in terms of who will take the decisions, because those were the commanders of the province, and there was a serious issue in terms of decision making at that high level to execute it down. So it's some of the experience, it's quite a number of experiences that are shared in the report by the colleagues in the various clusters. It was indeed overwhelming. Some of the experiences include the shortage of the oxygen and the fact that the infrastructure in the province it did not allow the hospitals to cater for the oxygens, because the piping systems had to be now either renovated or be done for the first time in some of the hospitals. So it was indeed, it just showed that KZN was overwhelmed, and there was quite a number of experiences that we faced as a problem. However, working together in a coordinated manner, the province emerged and came out victorious in terms of curbing the spread. And another thing, what I get from the report is the experiences in the Department of Education when the preparedness of going back to school, working together with the Department of Health in terms of the screening, it did really a great deal with the workload that the Department of Education was facing. So there were some cases where the colleagues, where they share in the report that there were cases when they feel that they were being defeated by the pandemic. However, there were always these meetings and these new strategies that will come up. And there's quite a number of strategies that have been developed in the province, the new communication strategies, the new digital strategies. It's quite a number of strategies that emerged as a result of how the second wave hits the province.
Okay, linked to that question, the lack of bed availability presented a big crisis in the province during the second wave. How would you avoid this if we enter the third wave?
The experience has taught the province that working together is one of the best. However, right now there is one other strategy that is being formulated or developed, and the premier is still, it is not yet approved, but it came from the Department of Health. The department is working with the premier, so we will take it from there. Unfortunately, I have not seen the content of that strategy as yet. However, I am told by the colleagues that the meeting was there on Monday, and there was a proposed new strategy by the Department of Health.
All right.
Even in terms of a vaccination rollout.
Okay, thank you. What do you think worked well in the province? And do you think whatever it is that worked well can be carried over post-COVID era?
Okay, yes. One of the things I can highlight is the digital digitization of everything in terms of the infrastructure of IT. I think the province can carry it to the next level. It will enable the province to achieve even more, because even when even those colleagues that are not the frontliners, when it comes to work in the way that COVID-19 has forced us, it was indeed overwhelming, but it is a shift that we can carry to the next years, even if there is no COVID, in terms of how we are taking advantage of the technology. Yes, we've been talking 4IR in the previous few years, but the way we were forced to get into it during COVID during this era is also evident that we are there already in the 4IR, and we can always improve.
All right, thank you for that. And one other bigger issue is the corruption around PPE procurement. And the question there is, how have you managed this, and how are you going to continue to managing it to avoid that corruption in PPE procurement?
The issue of the PPE procurement is indeed a serious issue, Chair. And by the look of the report, even in our report, it was not coming through in terms of what were the number of the PPEs that were distributed and the budget that was spent in the PPEs. Currently, we have the supply chain strategy that is being implemented, and that is being looked closely in the province. And one of the things that are being spelled out is the issue of consequence management, and in terms of the accountability of the people in that value chain. It comes out very strongly that the issue of the consequence management is one that is coming out. So currently in our report, I will say, because it is evident by our report that the issue of the PPEs is not really addressed at a reporting level. It is an issue that is subjected to the investigation, as well as the strong SCM prescripts and regulations, and therefore that is what exactly the Premier is very coming out strong about in terms of the consequence management and the 30-day payment, as well as what is in the strategy of the SCM. Thank you, Chair.
All right, thank you for that. One last question is, how did you make sure that non-COVID services in health are not compromised?
I think I do not understand the question.
Okay. The question is, how did you make sure that non-COVID services in health are not compromised?
I don't think I have a response to that one. Okay. It does not cross my mind. I don't think I have an insight or an exposure to that one. Yeah.
All right. Thank you. I will direct a question to Mr. Godfrey, but from a business continuity point of view. Futhi did mention something about business continuity. I guess even at the national level, you are concerned about business continuity, which links to that very same question, that what would have happened to whatever interventions that were already in place and COVID hit. And when you shift your focus to COVID, you still have to maintain the other interventions. Yes.
Yeah, for sure. I think that must have been a question that confronted many parts of government at different levels. Even companies were affected by that because the disruption itself was just too much. The major disruption that may have not even been anticipated in the plannings, the plans that were there were turned upside down because what happened we did not anticipate. So the disruption in terms of that there has to be a lockdown, meaning that certain activities needed to be stopped, especially the activities that require people to be traveling. We all had to change to working remotely. Budgets were affected in a big way by diverting resources to activities that are focused on intervening against the COVID pandemic. So that would then mean that certain activities would have been scaled down or postponed or cancelled at worst. So to come into the question that we have raised, I think it is also pointed in one of the chapters, I think the chapter in the country report, draft chapter on the country report on health, that there was also a challenge at some stage that whereas there was a prioritization of COVID patients, there was also always a risk that non-COVID patients will receive less attention. And to some extent, primary health care was compromised. To some extent, there were issues that were raised around attention that was being given to other major diseases like HIV and AIDS in terms of continuity of adherence to provision of so there were those things. So proper evidence is needed around that as to what extent have those things been affected. There's delivery of services that are non-COVID, other related things in that space, how they were affected. I'm sure there are researchers who have worked on that. They can provide more information in terms of how that has happened. But interestingly, from the case that was presented now, the way KZN, the way the presentation explained, KZN has used ICT platforms to ensure continuity and also to ensure that there is an upgrading of the way that government services will be delivered going forward, which will be sustained. It's actually a very good thing, and it's a best case, one of the things that can be picked up as a positive spin on the advent of the COVID. There are other points that I think are very important also from the presentation. I capture them under the topic of learning organization. That, for example, the coordination of departments by clustering them within the coordination of departments in the province by clustering them around certain activities, and also the knowledge sharing with the private sector. I think one can trace that back to the learning that the presenter was explaining here, that had led to improved preparedness of the province to deal with or to manage the response, the COVID-19 response per se. So I think that's a very, very important point that was made. But also the emphasis on the investment in ICT infrastructure, it comes out very, very strongly in this case. Thanks.
Great. Thank you very much. Thank you very much, Futhi. We will move to our next presentation.